Oh, good morning. I didn't know you could be so popular being so litigious, but I will take it. I will take it. And I want to thank you as well for giving me an opportunity to do a red eye again from California to be with you this morning. I used to do those every week when I was representing Los Angeles and for 24 years traveling to Washington, D.C., and I see my former Chief of Staff, Deborah Dixon, in the audience there, and I say, welcome, Deborah, to this. Always great to see you. To Families USA, I can count the battles with Families USA. To Frederick, thank you very much to you and your team for the leadership, for standing up, for doing what we in Spanish would say is doing it with ganas. Don't bother looking up the word in the dictionary. It's G-A-N-A-S. It won't ring true because really what it means, at least in my book, is gut, grits, and game. Gut, grit, and game. And that's what Families USA is all about. Gut, grit, and game. And that's what you need to be able to survive in this very cutthroat world we now know as Washington, D.C. And I think I most want to thank all of you for being here and for being part of Families USA, because what it means is you're committed if you're here. You're on the front lines if you're here. You, your families, are the real stories behind the fight that Families USA makes, the fight that we make, the fight that defines ganas. Make no mistake, we're in a fight. Our nation's health, as Families USA says, is in the balance. But so is the rule of law, our faith in justice. So is our institution of governance, its vitality. It's in the balance. Our very democracy is in the balance. Today, as we speak, the truth is on trial not far from here. Our pledge of allegiance to our country, not to a party or to politics, is on trial. Our elected leaders are on trial. Our ganas, our courage, our determination, our spirit are on trial. So for the next several minutes, I hope to talk to you about our nation's health, but really, what we're talking about is much, much more. The health and well-being, perhaps the salvation of our democracy. None of us, I think, are in this fight because it's easy or because it's fun. And if you're sort of nodding your head because it is, then you need to get out more often and have a life. I think we're in it because we must be, because it's personal, because it's the window to our future. Just this week, we were reminded how critical this fight really is. The Supreme Court just chose not to fast-track consideration of our appeal to shield Americans' health care under the Affordable Care Act from repeal. Now, I want to just assure you that it's not time to panic yet. Don't worry, we're not done. We will get before the Supreme Court, and just as we did twice before, we will descend from the halls of justice in Washington, D.C. with the victory. We will not accept anything less than a victory on the Affordable Care Act. Nothing less than the protections for pre-existing conditions for 130 million Americans. Nothing less than expanded Medicaid coverage for millions who would fall in the cracks. Nothing less than keeping the insurance policies, the subsidies, the plan options for millions. Nothing less than protecting seniors from the dreaded Medicare donut hole and co-payments. How do I know we'll get nothing less? How do I know we'll prevail? Because you and I are ready. Whether in a court of law or the court of public opinion, we will fight. Because we can't backslide. We're already behind. The richest nation in the world, and millions still without health insurance in our country, paying sky-high prices for meds, with infant mortality rates right here in parts of this nation's capital higher than those in developing countries? Why will we prevail? Because I'm the son of immigrants. Optimism, ganas, runs in my DNA. Because in 2010, I was there as a congressman to help write and pass the ACA. And in 2020, I'm there as the lead attorney with 20 states plus DC defending the ACA in court. What did you expect me to say? Ladies and gentlemen, this is not my first rodeo in DC. Back in 1977, as a congressman, I worked alongside Ted Kennedy and Henry Waxman to help pass the Children's Health Insurance Program, CHIP. In 2017, as California's AG, we took our fight to court to save birth control coverage under the Affordable Care Act. We beat the president's team and have stopped him because decisions about a woman's health should be between a woman and her doctor, not her employer and the president. We beat back the Trump administration's reckless health care refusal rule, which would allow anyone, from a front desk receptionist to a nurse to a doctor, to refuse to offer essential health care services to a patient for moral or religious reasons. We're fighting in court to protect low-income and immigrant families and their access to food and nutrition safety programs that are under attack by this administration. And right now, we're in the legal battle with, guess who, to protect Title X family planning programs from this administration's illegal gag rule that would threaten clinics, doctors, and patients. We're also fighting in court to protect low-income and immigrant families who really do need nutrition, safety net programs, the food that we count on. That, too, is under attack by this administration. You better stop me, because I could keep going. I've had to sue the Trump administration, as you heard from Frederick, a number of times, 67 to be exact, so far. If you invite me back next week, I suspect the number will change. We're protecting our air and our water from pollution and climate change. Our LGBT fellow Americans are getting our protection as well from discrimination in healthcare and in the military. Our students in college are under our protection. They're being preyed on by for-profit colleges and unscrupulous lenders. We're protecting our hardworking immigrant families against the relentless attacks by this administration. We've even fought against this president in court on the upcoming decennial census, which the president tried miserably to rig through an undercount of vulnerable populations. We beat him bad, all the way through the Supreme Court. And that's sort of the punchline. We beat him because in some parts of this town, in fact, in some parts of this city, people don't think he can be beat. Let me say it again. We have sued him 67 times. We beat him. We beat him. You see, it's not bad, huh? You see, it's not just about fighting, though. Whether you're fighting to defend our children or our health care or our rights as humans or as Americans, it's about fighting and winning. In almost all of those 67 lawsuits, we've been winning on the facts, on the science, and on the law. And it's not just about fighting and beating this administration. We must be prepared to take on anyone, anywhere, who tries to roll back our rights, our progress. In California, we've taken on big oil, sex traffickers, the gun lobby, tech giants, predatory lenders. I could keep going. And in healthcare, we took our fight for affordable prescription drugs to court, because today, 1 in 10 Americans will skip doses of medication because they simply can't afford to get the refill. Did you know that drug companies are cutting secret collusive deals that delayed cheaper generic drugs from reaching the market today? By delaying the entry of those cheaper generic drugs, they can charge prices that, on some occasions, can be up to 90% higher than what a generic drug price would be. Last year, we challenged drug companies and their so-called pay-for-delay backroom deals, and we got $80 million in a settlement against them. Then we wrote a new law in the state of California to help us combat that practice in the future. Now in California, we're zeroing in on the healthcare industry's trend toward consolidation and its anti-competitive behavior. The plain truth is that if care is not affordable and accessible in your community, it's really not affordable or accessible to you at all. That's why we investigated Sutter Health, the largest hospital system in Northern California. We sued Sutter, alleging that their anti-competitive business practices artificially raised prices for Northern Californians. It's no secret that in California, if you live in the northern part, it's no secret if you are from our state of California that if you live in the northern part of the state, you pay more for your medical care. The average inpatient hospital procedure in Northern California costs about $90,000 more than in Southern California. And that's after you've adjusted for the difference in the cost of living between the two areas. Northern California is the most expensive place in America to have a baby. In Sacramento, a cesarean delivery costs about $27,000. That's nearly double what it would cost to have a similar C-section in New York City. Try to make sense of that one. We saw evidence pointing to Sutter Health, the largest hospital system in Northern California. We saw its market dominance, and we saw those as reasons for the dramatic differences that we saw in pricing. Sutter is based in California, in Sacramento, our capital. That's why in March of 2018, after years of investigating, we filed the lawsuit against Sutter. And last month, we reached a settlement agreement with Sutter. If approved by the court next month, our settlement will be one of the largest actions against anti-competitive conduct in the healthcare market in the country. We secured first-in-the-nation performance requirements to restore competition in the healthcare market, and we also secured requirements for Sutter to pay $575 million to compensate employers, unions, state, and local governments. If this kind of market manipulation can happen in the capital of the most progressive state in the Union, can you imagine what's happening elsewhere in America? Actually, you don't have to imagine it. Other states have fought similar battles. In North Carolina, Attorney General Josh Stein, and in Washington State, Attorney General Bob Ferguson, both successfully took on large healthcare systems that were attempting to consolidate. Together, we are forging a path forward for states to challenge the big is automatically better orthodoxy and the inertia of an administration that prefers to look out for the big guy. Because no one in any state should be trapped in that kind of rigged game that we see being played far too often today. No one in any state should have to make choices about paying their medical bills or their rent or mortgage. And that's why we want the Supreme Court to take up our case defending the Affordable Care Act, so we can fight, so we can win. Because when the law is in question, that means your care is in question. And that uncertainty hurts all of us. Here's what I'm fighting to save: affordable, accessible health care for all of us. For Stephen in Los Angeles, who was diagnosed with leukemia at the age of 26 and learned his treatment would cost him $140,000 a year for the rest of his life. For 12-year-old Violet in Novato, California, who will need lifelong treatment for epilepsy and whose parents believe it was the ACA that saved her life because there are no limits, lifetime limits on coverage. We're fighting for that 24 or 25-year-old who needed coverage and got it through his or her parents, and the senior whose prescription drugs were covered so that the donut hole wouldn't swallow our seniors. We're fighting for them and for everyone with a story like theirs. We're fighting for your family and every family in this country because everyone deserves to get the care they need. We also have to fight for those we don't think of necessarily in this healthcare fight. The miners in Appalachia with black lung, the families in Flint, Michigan, or Newark, New Jersey drinking tainted water with lead, the kids in the Central Valley of California breathing smog and pollution when they play outside. We have to fight for them just as hard as we fight for those with leukemia or epilepsy or any other pre-existing condition. The health of our environment and the health of our people are inextricably linked. If we want to fight for one, we have to fight for both. I wasn't raised by a coal miner, but I was raised by a construction worker and a clerical worker. They worked hard. They earned very little. They always did things by the rules. For me, this fight for health care is personal. It should be personal to everyone who has to make those tough choices. Tough choices about whether or not they want to start a family in a community where they know their child will have 1 in 4 chance of having asthma, or whether or not they can go after that dream job without losing their health care coverage, or whether they can pick up the prescription medication waiting at the pharmacy or pay the rent. And this fight is personal to everyone who has been forced to pay more for health care simply because of their zip code. The plain truth is that care is not affordable and accessible in your community, then guess what? It's really not affordable and accessible to all of us. It's no secret that in California, we're working harder than most to make a difference. We want to change. We want to make sure that you know that California will not allow an AWOL government in Washington, D.C., or a very powerful marketplace filled with players who want to get bigger and bigger, stop us from getting to that mark where every one of us will be able to include our family, our parents, our children in the kind of healthcare coverage that we expect for anyone. It's time for us to realize that healthcare is in the balance, that our democracy is in the balance. We're on trial. Just as much as the truth is on trial, just as much as every elected leader is on trial, we're on trial. If Families USA really believes that it stands for health care for all, that's affordable, accessible, and of quality, then we're on trial. I hope you've got ganas, because we've got a fight ahead of us. But if you take California's example, where we lean forward every opportunity we can, then you will know how to succeed. Because we don't just pick a fight. We don't just get into a fight. We fight to win. And that is the way we all need to be. If you've got the ganas, then we can win. I hope that today, here in Washington, D.C., as some remarkable things are occurring not far from us, we will remember that democracy starts here. We keep it moving. And I hope that you will look at California and say that we're doing everything that we can to carry our end of the bargain. I hope you'll join us. If you're from California, hallelujah. If you want to come join us, we'll take you. But if you're not from California, guess what? we'll roll up our sleeves. We're right with you. We don't care where you're from. We believe that this country is great because we all work hard. If Manuel and Maria Teresa Becerra, a guy with a sixth grade education, who married a woman he brought at the age of 18 from Guadalajara, Jalisco, Mexico, could figure out how to get 4 kids to go through college or the military, even though they couldn't walk into restaurants because of the signs that said no dogs, Negroes, or Mexicans allowed, then we can have the ganas to make this happen. We're on trial. Our health care and our democracy lies in the balance. I think we're ready. I thank you for inviting me. Let's go to it. Thank you very much.